bem-vindos e bem-vindas a uma nova edição do Caminhos para o Mundo, programa do Brasil de Fato em parceria com a Assembleia Internacional dos Povos, que traz sempre temas relevantes e atuais sobre a política internacional e a luta dos movimentos populares de todo o mundo. Hoje vamos discutir os impactos da covid-19 no mundo e as conclusões que podemos tirar sobre os sistemas de saúde após 2 anos de pandemia. A covid-19 infectou mais de meio milhão de pessoas em todo o planeta, provocando mais de 6 milhões de mortes, segundo dados da Organização Mundial da Saúde, a OMS. A descoberta de um vírus altamente contagioso que obrigou os governos a adotarem medidas como isolamento social também revelou uma série de fragilidades nos sistemas de saúde, que atravessaram uma onda de privatização a partir dos anos 80 com a ascensão do neoliberalismo. Para discutir os impactos da pandemia nos sistemas públicos de saúde, vamos conversar com alguém que esteve na linha de frente, atendendo pacientes na Índia, um dos países mais afetados pela emergência sanitária. Dr. Yogesh Jain, seja muito bem-vindo.
Pleasure.
Yogesh Jain é indiano, médico pediatra. Foi fundador do Grupo de Apoio à Saúde do Povo, um programa que oferece atendimento médico a 2.500 comunidades em zonas rurais da Índia há 20 anos. Especialista em saúde pública, Jain também é membro da Sanghawari, uma organização sem fins lucrativos que assessora o Estado indiano sobre medidas contra a Covid-19 e foi editor do livro Covid desde as Margens, que reuniu relatos de profissionais da saúde que atuaram no combate à pandemia na Índia. A partir da sua experiência de mais de 20 anos com o Grupo de Apoio à Saúde do Povo, o que você pode dizer sobre a saúde das populações rurais na Índia? Quais foram os maiores desafios e conquistas desse programa, tendo em vista o sistema de saúde do país?
So, Aline, I must say, India is one of the most unequal countries that exists on this planet. Somewhat, a large country with some people who have one of the countries with a few billionaires, but also an extremely large proportion of people who are very poor, and also are marginalized in other ways, away from the big cities, in forested areas where access is an issue. And I think the food availability for large proportion of people is also extremely poor. Now, this manifests as an excessive number of illnesses that people suffer from, and they range from the conventional illnesses of poverty like tuberculosis or malaria or leprosy, but also a lot of non-communicable diseases like diabetes, hypertension, heart diseases, asthmas, as well as also the conventional problems of women when they have problems during childbirth, or children when they are young, below the age of 5 years, plus in any case a large number of trauma people also. So I think the illnesses are large in number, and the health systems that we have in our country are more on paper, and we have a very poor public health system, which only caters to 25% of the people's problems, and an uncontrolled private health system looks after the healthcare of 75% of the problems. Now, and all this, leads to people having very poor health indices in the country. We have a large proportion of people. Still have very high infant mortality rates. Still, a lot of women die in childbirth. And India is a country with the largest number of people with tuberculosis and who die also. So almost 1/4 of all tuberculosis patients in the world are from India only, as well as and there are over 200,000 deaths due to tuberculosis in our country every year. So we have a very bad situation, and medical poverty. That is, people actually becoming poor due to seeking healthcare from a private system when they are desperate in need, is a reality for a lot of people in our country. And I would say, the situation is probably far better in Brazil, that I might know, but because Brazil had some sort of a family, a better health system for some years in the first decade of 2000s. but India continues to be poor for the last 70 years since it has been independent.
Como a experiência dos povos marginalizados da Índia, no âmbito do acesso à saúde, se relaciona a outros povos vulneráveis pelo mundo?
Well, I would say India would be, I would be ashamed to say that the poor people in India actually have some of the poorest health indices in the world. That is not to say that, that poor everywhere or the marginalized everywhere suffer in relation to the not so marginalized in the rest of the world. So I think the poor in South Africa or in Brazil or in Indonesia or in India, that the 4 large countries that I know with large populations, all have poor situations. But in India, it is sort of not uncommon for people with tuberculosis to die, a woman in labor to die, or people were denying. In COVID, we saw so many problems where people died because they couldn't get the care, as well as with other conventional illnesses. The chances of becoming sick are more, and the chances of coming out of the illness due to care are far worse in India than I think in any other country in the world. I think at some level, our rates of illnesses are and the recoveries from those illnesses are much worse than even sub-Saharan African countries, where we know, which has been traditionally the poorest part of the world. But in India, as I may use an example of tuberculosis, the average weights of people with tuberculosis in central India are about 10 kilos less than the weights of people with tuberculosis in sub-Saharan Africa with HIV. India does not have much HIV as of now. So, but the weights of people with tuberculosis are much poorer in India by 10 kilos. So if the African people weigh 45 kilos body weight, adults, the Indian would weigh 35 kilos. Or if they weigh 50 kilos, then Indians weigh 40 kilos without HIV. So that is the level of deprivation that people suffer from. And I would say, illnesses are basically biological embodiment of deprivation. And a large proportion of Indians suffer this injustice, if I may say. It's not only inequality, it is injustice of poor availability of resources that large proportion of Indians suffer from.
Yogesh, você é um defensor do direito à saúde e da construção de um sistema de atendimento popular dedicado à comunidade. Quais os principais obstáculos para a construção de sistemas mais igualitários dentro do capitalismo?
I would say the biggest challenges are, still access to of these centers to the resources like HR, to get doctors and nurses as well as other paramedics to run these programs in so-called poorly accessible areas is always been a challenge. And the skill sets of these people who work in poor areas are often poorer, and they require much larger amount of training and mentoring that is not easily available, for which we had to work very hard to sort of develop these systems. The second thing is the mindset that people in small places, that is poor places where poor people stay, don't need much healthcare. They can get with poor health systems. So there will be fewer drugs and fewer equipment and services available in hospitals that are meant for poor people. So to break that mindset and to establish that the health systems and the facilities that should be available in poor areas should be in fact superior to the people, to the healthcare systems in the cities. So I have never been able to understand where did this logic come that the biggest hospitals have to be in the biggest cities, and the villages and the poor cities should get small health centers. Is it that people in cities have more illness? I don't think so. I think there are more illnesses where there is more poverty, And I would say the best facilities should be, or at least as good facilities should be there in the poorest parts of the country or a province. And that is what we work towards. And I think, the other problem that we faced was the technology that is prepared for poor people's, for small hospitals and villages, in cities and small villages, should be, is not actually made. So if I have to keep something drug like insulin, which requires refrigeration so that the drug does not get spoiled, insulin, those refrigerators are not there in villages. So how, you have to prepare some other ways of keeping drugs cool, or similarly, like something like anti-snake venom, the medicine that is required for snake bite care, that also requires refrigeration. So whether we need technology of this level, so that has been also a challenge, and we have been also developing technology that helps people to get the right type of healthcare, the best healthcare in poor areas. And but I think the largest problem, I would say, is the problems of adequate food for people, so that they don't become sick as frequently, and when they fall sick, they should be able to recover by getting the right amount of food which is balanced and nutritious. Of course, there are problems like there are poor roads in small villages in India, which often get cut away from the bigger places during rains or due to the water. So and if a woman in end pregnancy wants to get a childbirth in a hospital, and if there is no road, then there is a risk of that woman dying in the village. And those are also challenges that we have worked upon to organize making of roads and vehicles on that road so that people can reach health facilities when they need it.
Sobre a covid-19, o que você considera que a pandemia expôs sobre o atendimento à saúde no mundo? E quais alternativas os governos e movimentos populares podem construir para melhorar essa situação?
So I would say certainly we have learned a lot, but I would point out three sort of major learnings that I've seen. First is that the COVID-19 pandemic exposed that we are a very unequal world. So, everything that happened, whether it was the drugs that were available, whether it was the protocols for treatment, whether it was a vaccine, whether it was, community programs, whether it was, food availability, all of it was exposed. The problems in these areas was exposed according to the level of inequality in a country or in the world. So, in Africa, there is a major food security problem that has happened because, they have always been on the wrong side of equality, as well as, whether the world who gets the vaccine, who gets the drugs that are prepared for COVID, who gets the benefit of research, that has been a problem. And I think even in small areas like a province in India, we could see the people who are poor suffered the most compared to the people who are not poor, even though the disease initially affected those people who were traveling by air. But finally, it was the poorest people who suffered most in India or everywhere else in the world. The second learning I would say is that we people have realized, and I think if they have not realized, they should learn soon, that to provide care during pandemics or major health problems in an unequal world, you need good public health systems, and the private health systems are not a solution. And nowhere in the world we know that any country has been able to provide healthcare to all its people through a private health system. But COVID-19 showed it very well that all those areas, that the private sector in India, at least, they actually stopped providing care because they were so scared. So the private sector did not, when even the government was giving them money, they did not want to open their hospitals, and they were only the public hospitals and health centers were the places where people could get health care. So I think that was that, and I know countries in Africa, Latin America, as well as in Asia, are they fawn over the private sector. They sort of give a lot of concessions to the private sector so that they can provide care, actually giving them inducements to run private health systems. But private health systems failed completely in the COVID-19 pandemic, as I would say. And I would say the third, which is learning that I would immediately remember, is that all the countries which were called as COVID pandemic prepared, which included the number 1 and number 2 slots were of USA and UK, as well as other Western capitalist economies in Europe. All the countries which did sort of, a lot of countries did very badly, but the countries which have done well, or the provinces which have done well, are those which are socialist economies, if at all. Say whether it is China, or whether it is Cuba, or whether it is my own state of Kerala in India, or whether it is Vietnam, or whether it is some other countries, like even Venezuela did better than some other countries in Latin America. I think countries which have decentralized system of healthcare system, as well as a health system that sort of serves everyone rather than serve the richest first, are the ones which did best, which had a sort of a public health system in place. So otherwise, see, the countries which have done the worst include UK, US, Germany, Italy, France, and these are the countries which have done so badly, and including Brazil, if I may say, or why not India? India probably had the worst COVID-19 pandemic in the world.
Da pandemia, quais serão as medidas imediatas mais importantes a serem tomadas pelos governos para melhorar as condições de saúde, especialmente das pessoas mais pobres?
So I would say a single message that is staring at every country's face is that we should have a strong public health system in place, because this pandemic might come back through its variants. But it also, other pandemics might come also due to other illnesses which we cannot predict at the moment, but they are sure to come, as well as other already existing health problems that we have, which are bleeding our people. Those need to be looked after by a strong public health system. And I think it is not too late that we start now and sort of build up public health system and stop investing in private health systems anymore, and that means a lot of things, which includes surveillance and ensuring that drugs are there for everyone, that everyone is able to access all the investigation that they're required, plus investment of finances for running good public health systems should be now made by the governments. I would say that is one straightaway thing. But if you want to ask me for this particular pandemic itself, I would say that that I think we should use this time, that the margin that we have at the moment, because the pandemic is at the moment on the decline, to vaccinate everyone, whoever has not been vaccinated. Through now we should forget about this apartheid that we have done for the vaccines, and make it available for all those who have not got the vaccine, rather than vaccinate children who don't require the vaccine, which many countries are doing at the moment. So I would say, and to introduce and other lessons to learn from for countries is to not destroy the environment as we are doing. We should learn from it. That even the COVID-19 pandemic also happened because we were on a pathway of destroying the the environment in Asia, that was probably the reason why this pandemic came up, and other pandemics might come up if we continue to destroy the environment even more.
Você é editor de um livro que tem o objetivo principal de registrar a memória da pandemia pelo viés das margens. Por que o registro por essa perspectiva é tão importante?
I would say that, when histories are written of anything, histories are often written through the voices of the king or the queen or the people in power, those who write the history. But actually, what we need for the later times is to have a people's history of a particular phenomena, which COVID-19 was. And we have wished that this book records the people's history of what they faced during the pandemic. How did the indigenous communities faced? How did the poor on the street faced the pandemic? How was the research done on them? How were the drugs denied to them? And how did the poorest in the health system also suffered? So I think, we wanted this to be useful as a repository of knowledge and information for future times, when we want to learn how we managed to sort of manage this pandemic so poorly, so that we learn in the future, and as well as recording of the experience of a full class of underprivileged people, so that that is a counterpoint to the view that is expressed in medical journals, as well as in the records of our states, of our governments, which is usually very self-congratulatory, if I may say.
Dr. Yogesh, muito obrigada pela sua participação no nosso programa. Foi um prazer recebê-lo aqui conosco.
My pleasure. Thanks again.
O Caminhos para o Mundo fica por aqui. Para rever este ou outros programas, basta acessar o canal do Brasil de Fato no YouTube e acompanhar a gente pela TVT. Um abraço e até a próxima!